Good afternoon, and welcome to today's event, Effective Resilience and National Strategy, Lessons from COVID-19 and the Implications for the Biden Administration. I'm Barry Pavel. I'm a Senior Vice President at the Atlantic Council and Director of the Council's Scowcroft Center for Strategy and Security. Last October, the Scowcroft Center's Forward Defense Team released a report on effective resilience and national strategy, lessons from the pandemic and requirements for key critical infrastructure by Atlantic Council Board Director and Distinguished Fellow Frank Kramer. The report advances a strategic and operational framework for effective resilience, which is the capacity to prepare for or withstand shocks of the magnitude of a major pandemic or equivalent, in essence, a strategic shock. Today, as President Biden confronts COVID-19, our report and its recommendations on health security remain timely. To discuss these issues, I am very pleased to welcome a variety of distinguished voices to our event today. Atlantic Council Board Director Jane Hall-Lute joins us to provide keynote remarks and will help us frame this discussion. She'll be followed by report author Frank Kramer, who will present his key findings prior to joining a panel discussion alongside Frank. David Bray, Peter Jacobson, Jacqueline Levy, Chris McGuire will sit on our panel moderated by the Deputy Director of our Forward Defense Practice Area, Clementine Starling. I'd like to thank these speakers for joining us and our audience for tuning in virtually. In accordance with the legacy of former National Security Advisor General Brent Scowcroft, it is the mission of the Scowcroft Center to develop sustainable, nonpartisan strategies to address the most important security challenges, not only those we face today, but those of the future. Consistent with that mission, our Forward Defense Team seeks to shape the debate around the greatest military challenges facing the U.S. and its allies, and looking at forward-looking assessments of the trends, technologies, and concepts that will define the future of security. Through this work, including this report and our other work on the future of DHS, we have identified the homeland as a theater increasingly under threat. COVID-19 is the most salient example, but it is not unique. The challenges presented by the pandemic are reflective of a broader spectrum of non-kinetic risks to U.S. critical infrastructure and national security, such as cyber attacks, industrial espionage, potentially bioweapons. Unfortunately, the resilience capabilities of the health, economic, and security sectors remain insufficient to address these risks. If the U.S. is to avoid and mitigate major system shocks like COVID-19 in the future, the president will need to prioritize an expanded focus on resilience in the early days of this administration. To kick us off for our event today, I want to turn it over to Ms. Jane Hall-Lute, an Atlantic Council Board Director, current President and CEO of SICPA North America, former Deputy Secretary of Homeland Security, and a wonderful colleague of mine. In her role at DHS, Jane was responsible for the management of the department's efforts to prevent terrorism, secure and manage the nation's borders, and strengthen national resilience. She offers a distinguished understanding of the ways in which the U.S. has in the past and can today leverage tools across government to build resilience, both responding to current crises and preparing for the next ones. Jane, thank you for joining us today and for your dedicated service to U.S. security. We look forward to hearing your perspective on these issues. A couple of housekeeping notes before I turn it over to Jane. This is a public event on the record. We encourage our audience on Zoom to ask questions using the Q&A tab, which you can find at the bottom of your screen. Please identify yourself and your affiliation in your questions. We'll be collecting these throughout the event, and our moderator will pose them to the panelists. We also encourage our audience to join the discussion on Twitter using the hashtag #ForwardDefense. Once again, thank you all for joining the Council Scowcroft Center for this important discussion. Jane, without further ado, over to you.
Barry, thanks so much. And it's poignant to me and to all of us that you spent a few minutes talking about Brent Scowcroft. He was laid to rest this past Friday. A slight man in physical stature, but a giant to those of us who knew him. And for those of us who did have the privilege of working for him, the thing that you come away with impressed, and for me, it's now 30 years later than when I first met Brent, is his humanity and his humility and how he approached everything. But he was deadly serious about his work and about those of us who worked for him. And he had a very dry and wry sense of humor. I remember he He walked in the day after the election in 1992 and said, "We've all been fired, but we can take some small satisfaction in the fact that apparently foreign policy had nothing to do with the outcome of the election." Another time I remember he told me quite directly, he said, "Listen, when you sit down and you type in memorandum for the president, that's where it goes. So be right." It was a lot of pressure as a young professional in this field, but a lesson that I've kept with me my whole life. And there's a lot that's right in this report that Frank has written and that we'll explore today in this conversation. And I want to talk about effective resilience and national strategy, particularly from a perspective of Homeland Security, but not only. And I begin by thinking about, as I have often done when I served in government, is what, if anything, is government good for? What does the public expect from government? Because let's face it, most of us don't interact with government unless we have to, with one exception, and that one exception is voting. But other than that, there's none of us, rushing down to DMV. Oh, good, let me call the tax office. No, none of us interact with government unless we have to. And when we think about it, particularly today, in today's world, what, if anything, is government good for? I think government is good for three things fundamentally, and that is delivering threshold conditions of security, well being, and justice for its citizens. So we'll talk about well being today and spend a lot of time on the particular challenges of COVID-19 pandemics and public health more broadly, the whole question of health security and resilience. From the perspective of Homeland Security, this question is not just an academic one, or not just a policy matter or a regulatory matter. This is a question of action. What should the department be doing? Indeed, what should the whole of government be doing? What should it be doing? Washington understands policy making departments and they understand regulatory departments. It doesn't understand too well when there is an active operational requirement that departments are expected to perform. For Homeland Security, we were often faced with the question, why do we even have this department? And the purpose of Homeland Security is really to help create a safe, secure, resilient place where the American way of life can thrive. And as Barry mentioned, we focused our efforts around five key missions. Certainly preventing another 9/11. That's how the department was founded. Administering and enforcing our immigration laws, our role at the border, of course, ensuring cybersecurity for the nation's critical infrastructure, and building national resilience in the face of disasters. Well, how should we distribute responsibility for building that resilience? And what does resilience really mean anyway? And how do you do resilience? Resilience, certainly, as we all know, is the ability to bounce back. It's certainly easy enough to fall down. It's surprisingly easy to get pushed down. But it's more challenging and difficult to bounce back. So how do we bounce back? What does it mean that we need to do? In the first instance, I think people need to unify around a common cause, a common theme, a common effort. We need to agree we're in trouble here, and no single one of us can do all that needs doing. All that needs doing can't be done alone. We need to come together. And we need to have better and smoother processes for doing that, whether it's at the interagency or between the federal government and state and local governments, or within communities or even families themselves. Unifying around a common threat or cause and then pulling ourselves together through reliable systems of interaction. This is what made FEMA emerge more successfully over the years, that it has gained more experience, not only interacting with other parts of the federal government again, but interacting at the state and local level. Indeed, FEMA very often judges its greatest successes to be not what the federal government is doing for communities, but what they are able to do for themselves and drawing on nearby help and through mutual assistance. COVID-19 has been something that the likes of which very, very few of us have ever been through before, remarkably, and it's a testament to modern medicine that there are some of us alive today who have been through something like this before. So we all have an expectation that modern medicine will get us through this again. But as we've seen, medicine is not enough. Having the vaccines are not enough. They need to get out to where they're needed. We need a steady state of reliable supply in which we can have confidence. And we also need to develop resilience against other unforeseen events, and the unforeseen coincidence of events which can compound the difficulties that we face. I commend this report to you. It's really quite extraordinary. As Barry said, it was written by Frank Kramer, who's not only a distinguished member, a distinguished fellow of the Scowcroft Center, but a member of the board of directors of the Atlantic Council, and has himself had a distinguished public service career. So, Frank, I'm going to turn it over to you and to our colleagues for a very rich discussion. And I thank you all for joining us today.
Great. Thanks very much, Barry, and especially Jane. And I couldn't agree more with what you said about Brent Scowcroft. I never worked for him, but I came to know him well starting in the 90s and then for many, many years thereafter. If we could all be like Brent, we would be really well off. I want to pick up on what Jane said. This is a report about security, it's about well-being, and it's about what we should be doing, as she put it. The report basically says what we want to try and do is avoid another COVID-19 scenario, future health crisis. We need to start to take action now to do so. The goal is effective resilience. We want the United States to have the capacity to deal with, and ideally by heading off, but if not by coping better with the future pandemic than we've been able to do with the current crisis. And to that end, the report makes 5 broad recommendations. First, it says we need to undertake major R&D programs focused on emerging and infectious diseases. We need high levels of constant targeted funding. We need to engage both the public and the private sector, the capabilities in each, and have them work together. We need to look for what I would call major breakthroughs. Some people talk about moonshots. They could be things like a universal flu vaccine. They could be antimicrobial capabilities. They could be a global health surveillance system. We need perhaps to put all of those together. So R&D in the first instance. Secondly, we really need to enhance public health. Public health is really the first line of defense in coping with the pandemic, in dealing with preventing and responding to pandemics. Public health operates, of course, at the local level, but the funding in the United States largely comes from the federal government. And it's generally agreed that, say for the past 20 years or so, that public health has been significantly underfunded. The best estimates are that it would take about $4.5 billion annually to bring public health up to where it needs to be. That's a lot of money, but it's not a lot of money compared to the devastation from COVID-19. And it's terribly important as we think about spending that money to focus on the people who are critical to making public health effective. We're facing a deficit over the next 10 years of doctors, of nurses, of laboratory technicians, of pharmacists, of a full spectrum of people engaged in public health. So as we spend our, hopefully, additional money, we need to spend it wisely and really focus on the people. Third, we really need to make effective use of artificial intelligence, one of the great capabilities that has arisen and can be used and has been used already with respect to the pandemic. Now, the Congress has already created the National Security Commission on Artificial Intelligence. And so what the report recommends is that the AI Commission create a framework for using data for research and development, for prevention, and if necessary, for operations in the context of a pandemic. There's a lot of data out there, and there's more being generated every day. But not all data is relevant to all problems. It needs to be organized properly, and it needs to be made available to both researchers and to analysts. A lot of that data also, of course, is personal health data, and that needs to be appropriately protected. So one of the key issues is to create, you might call them cybersecurity programs, create cybersecurity programs that allows for both personal health data to be utilized at the same time protecting the individual's security of data. And lastly, while this might not only be an issue with respect to the AI Commission, we've seen cyber attacks on health providers, we've seen cyber attacks on researchers, and we need to make sure that those entities are protected as they go about doing their work. So a cybersecurity program that will both before any pandemic, but certainly in the course of a pandemic, make sure that entities can be effective is another critical set of issues. Fourthly, it's perfectly obvious that pandemic's a national problem. And so what we really need to have is an organized national approach if we're going to deal effectively with future pandemics. And that would involve, I would say, three key elements. The first is to recognize that while the current system, which actually works fairly well, is for, with respect to natural disasters and similar things, for states and localities to take the initiation, the first steps, and only bring in the federal government if necessary, that won't work when we have a national problem such as a pandemic. We need to turn things around, and we need to say, if it's a national problem, if it's a pandemic, the federal government has to be engaged from the get-go. The current legislation is called the Stafford Act, and the report calls for what I've called the Stafford Act Plus. That is to say, give the authorities to the federal government to engage immediately and to work with state and localities. Now, that last point is also critical. It is the states and especially localities that's going to do the work. So one of the things the federal government has to do is to provide the technical support, provide the resources, provide, for example, an appropriate testing system that could be utilized, that can work and integrate from one state to another. And it needs also to plan and organize and exercise what would be done in the context of a future pandemic. So in the federal government, there ought to be some kind of what's sometimes called the joint interagency task force, which brings together all the departments together. And that joint interagency task force would work with states and work with localities to plan, to train, to exercise together so that in the event something happens, we're not, as people sometimes said, exchanging business cards, as a disaster continues going. We know one another, we've worked together, and we know how to work together. And lastly, Barry raised this point, we need to think hard about the problems of bioterrorism and biodefense. Synthetic biology has made a lot of strides, many to the good, and there are many good ones coming in the future. But malign actors can also utilize synthetic biology for bad ends. So we need to do a number of things. We need to create a biosurveillance program. We need to include in the stockpile material that can respond to potential pathogens. We need to undertake significant R&D by agencies with advanced capabilities like the Defense Advanced Research Project Agency or agencies within the NIH to get ahead of the curve with respect to bioterrorism. We have some early warning. We need to utilize that. So to sum up, dealing with a future pandemic, 5 things are important. 1, increased research and development. 2, greater support to public health. 3, best use of artificial intelligence. 4, create a national plan. And 5, utilize the early warning we have with respect to bioterrorism. Those are all things that I think are important. I think they all are doable in the context of effective resilience. And I look forward to the discussion on these issues. Thanks very much.
Thank you, Frank. Terrific. So that was most helpful to have such a thorough run through of your comprehensive report. Very much looking forward to delving into many of the issues that you just highlighted in our discussion. Hi everyone, I'm Clementine. I'm the Deputy Director of For Defence at the Atlantic Council. And I am delighted to be moderating this conversation today with such esteemed experts in the health and security sectors. So to introduce our panel, I'd like to welcome Peter Jacobson, who's the Professor Emeritus of Health Law and Policy and the Director of the Center for Law, Ethics and Health in the School of Public Health at the University of Michigan. Then we have Chris McGuire, who's the Director of Research and Analysis at the US National Security Commission on Artificial Intelligence, an independent commission which considers the advancements of AI among other technologies for US national security. Delighted to have you with us, Chris. And then we have Jacqueline Levy, who's the Director for Science and Research Policy at the Infectious Diseases Society of America. She's also an Atlantic Council Millennium Fellow. And then we have David Bray, who's the Director of the Atlantic Council's Geotech Center, as well as the Executive Director of the Commission of the Geopolitical Impacts of New Technologies and Data. And then last but not least, obviously, you've just heard from the Honourable Frank Kramer, who's the author of the Effective Resilience and National Security Report and a board director and distinguished fellow with the Scowcroft Centre at the Atlantic Council. So we really do have a range of expertise here, and I'm eager to kind of delve in. Just as a reminder, if you have any questions for the panelists, please put them in the Q&A section at the bottom of your Zoom chat, and I will come to them in due course. But to delve in, I wanted to just kick off with questions. So as Frank summarized in the Effective Resilience Report, this was released in October, but still this discussion remains very salient as we continue to grapple with COVID-19 here in the US and globally. So to begin, I'd love to hear each of our panelists' perspectives on the gaps in the US COVID-19 response and lessons learned moving forward. Peter, what are your top lessons learned from how we've dealt with this pandemic thus far? And how can they lead us to a better set of approaches for pandemics moving forward? Is it greater investment in health sector resilience? Is that part of the answer? What are the key areas for funding for public health that must be increased?
Thanks very much, Clem, for having me on this panel. It's a terrific report. I commend Frank for writing it. In particular, I want to focus on the public health, the inadequacies of public health funding, as that Frank mentioned in documents in the report. Those of us in public health are well aware of the underfunding. Let me just give you one data point. I was in fact, chaired the local board of health for Washtenaw County, Michigan, Ann Arbor. And we, right now, our budget is based on $1992. So imagine trying to deal with an opioid epidemic, youth suicide, obviously the pandemic, the COVID-19, all based on $1992, plus everything else we're responsible for as a health department. So having the Atlantic Council recognizing the problem is a great benefit to the public health community, and I commend you for it. Let's start with what was a success, and that is the vaccine development and procurement. Whatever else one might want to say about the Trump administration, Operation Warp Speed was a tremendous success. I've now had 2 vaccinations, I'm pleased to say. My wife won. But there were a lot of failures, and that's really to your question, isn't it? We could spend the next couple of hours just talking about what went wrong, but I'll just highlight a few. I'm sure my fellow panelists will have others. As mentioned, the pandemic exposed the consequences of underfunding public health, the inadequate staffing, the poor messaging, and I want to come back to that, the lack of distribution channels, lack of leadership on all levels, federal, state, and local. And what do I mean by that? Pardon me. I mean that there was just poor communication. If you think about it, we started, masks don't work. Well, maybe they work. Well, you must wear a mask. So how do people respond? How do people understand what they're supposed to do when you have these mixed messages? As a result, I think you have this poor planning for how to distribute the vaccines. It's an implementation failure. So if I were to add just right now, one thing to Frank's point that he alludes to, we can't just think at a high level when we're developing policies at all levels of government. We have to think about the implementation, and we can see the distribution failures in our daily lives. I'm one of the lucky ones to have gotten both vaccines. Poor coordination within and across levels of government. We've seen that in many areas. The bioterrorism planning exposed the poor communication, poor coordination across governmental levels. I've seen it in studies of regular preparedness, the inability for the funding, for the bioterrorism funding. You had 3 different federal streams. They didn't talk to one another in the federal government, let alone talking to states and localities of what you need. So what happened? Local public health asked for and got equipment they didn't need because there was money. And that raises an important point. If we look back at the bioterrorism funding, it was for dual use. It was supposed to be bioterrorism only. Public health departments used it to hire staff, but when the money ran out a decade later, those staff had to be fired. So we have to think of what's sustainable. It's not just funding, but it's sustainable funding. Okay. We failed to anticipate the effects of COVID-19 on vulnerable populations. Who were the people most dying and exposed are communities of color and low income. That's, again, a failure of implementation, of anticipation. We failed to keep people whole economically, so we're asking them to stay home. Many don't have the luxury, those of us on the panel had, but working from home, essential workers, all of the healthcare workers. The health system was overwhelmed. There was no sense that the health system needed not just equipment, the PPE, the vaccine, the ventilators, the treatments, but we know that people didn't get other healthcare they needed because the hospitals were at capacity. And finally, I don't think we anticipated the depth of the resistance to science and public health. We know that there are vaccine resistance, nothing new, but the depth of the resistance to public health, to science, I think surprised even me. And I was prepared. So you have attacks on public health officials. You have that horrible scene in Lansing, Michigan, when people were asked to stay home, to wear masks, to social distancing. So you have they all link together in a sense. And I'm taking my time, so I don't want to, I'll come back to what do we do with the money? Because I have some specific suggestions for that, but I took too long on the failures.
Yeah. Thank you, Peter. And that was quite comprehensive. And I think you've laid a lot on the table that I'm sure others will have thoughts about too. Jacqueline, you played an active role in COVID-19 planning and response efforts. I'd be interested to hear your thoughts, maybe reflecting on some of what Peter said, but also about what you would do differently to build resilience, not just in kind of managing COVID-19, but building resilience for future health shocks, such as a future pandemic or another health security threat.
Absolutely, and thank you for having me today. Frank and Peter have shared some statistics already about U.S. public health infrastructure, and I'll add just one more to start. Public health spending as a proportion of total health spending in the U.S. has been decreasing for about 20 years. And as a result, in the last decade, the workforce has shrunk by about 56,000 positions. And so that was our starting point here in the U.S. in terms of our response when COVID hit. As Frank also discussed in his report, in terms of the greatest barriers to an effective response, the US government has developed already prior to 2020 a number of pandemic preparedness programs and resources, but operationalizing them during the pandemic proved to be a challenge. So while effective pandemic response is contingent on surveillance and containment and public health infrastructure at the local levels, as we like to say in infectious diseases, an ounce of prevention is worth a pound of cure. Federal coordination and federal support are absolutely critical to mounting a successful response. Part of that support includes increased research funding for R&D, a sustained reinvestment in our public health infrastructure, which has already been noted. And I think finally, this hasn't yet been mentioned, but the lack of a coordinated centralized testing strategy funded by federal dollars. Without that in this past year, the pandemic was allowed to flourish while healthcare systems became overburdened. And then I imagine we'll get into R&D in a bit, but taking some of the lessons learned from COVID in the research infrastructure, in the diagnostics and testing infrastructure, in our regulatory spaces, and saying, how do we continue to make this progress that we have while preparing to face down future unknown challenges?
Thanks, Jacqueline. So you raised R&D, which I think is definitely something I want to delve into, and maybe opening this up to whomever has thoughts. What are the most important areas for future research and development? How would you go about setting up R&D programs now to focus on the next pandemic, the next future shock to come? Jacqueline, I don't know if you had thoughts on that. David, Chris, eager to hear your perspectives as well. Jacqueline, maybe I'll turn to you first.
Yeah, certainly. I think first and foremost, it's important to remember that a pandemic doesn't change the fact that we've continued to face a number of critical infectious diseases threats. Two things that Frank specifically mentioned in the report, which I wholeheartedly agree with, are the search for a universal flu vaccine, as well as antimicrobial resistance, both of which are perennial issues that threaten to exacerbate any novel issues or bioterrorism issues that we may face in the future. So that said, we have an excellent opportunity now at the start of a new Congress and administration, and as we begin to turn the corner on this pandemic, to sort of rethink the biomedical research enterprise based on these lessons learned. So repurposing successful research infrastructure to target other high priority unmet needs can be done if we take what we've built in the last year. NIH has multiple programs devoted to health equity, testing, clinical trial capacity, taking these and leveraging them with additional federal and private partners, coalitions, et cetera, to keep the momentum moving forward and to keep, most importantly, those relationships and the lines of communication open. This has been mentioned a couple times. I'm sure it will be mentioned a few more, but appropriate funding to maintain that clinical trial infrastructure, investigating things like platform trials and networks so that you can expand these clinical trial networks. There needs to be more pragmatic research for community-based settings. A lot of participants who are most disproportionately impacted by public health issues, and particularly by pandemics like COVID, are unable oftentimes to participate in trials that are funded through larger academic medical centers and in very specific regional locations. So just a few thoughts to kick off, but happy to dive deeper into any as we proceed.
Great. David, I want to bring you in here because you previously served on the National Commission for R&D. What are your major takeaways for producing effective R&D? And are there areas where funding for R&D are not necessarily at the right levels?
Well, that's a great question. And I would say whatever you do for R&D needs to be linked to how you will respond. In a past life, I was with Bioterrorism Preparedness Response, joined a little known program of only 30 people back in 2000 at the CDC that did bioterrorism preparedness response. And about every 6 or 12 months, we were told we didn't need to exist. That, why do you need to be prepared for bioterrorism? The Cold War's over. And it was literally scheduled weeks in advance for me to give a briefing on September 11th, 2001 at 9 o'clock in the morning to the CIA and the FBI as to what we would do technology-wise if a bioterrorism event happened. Of course, September 11, 2001, the world changed. We had an actual terrorism event, so that briefing was postponed. We dealt with the response to 9/11. So down from high alert on October 1st, I ended up briefing the Interagency Intelligence Committee on Terrorism on October 3rd, only to have the first case of anthrax show up on October 4th. So it was a very busy time. Now, I think what we need to think about when we think about R&D is first responders will use what they've trained on and what they're used to doing. So the last thing you want to do in the midst of a first responder event is to interject new ways of doing things because it's going to disrupt the crisis response. So if we want to be ready for future pandemics and other types of outbreaks, whether they be human caused like bioterrorism or naturally caused or even shocks from climate change or things like that, we've got to practice and integrate R&D into what we're doing up front. This also gets to what Peter was saying, what Jacqueline was saying, which is, in some respects, I would say what COVID-19 was for the United States was past successes set ourselves up for future failures. We thought that we had gotten past severe acute respiratory syndrome. We thought we had gotten past H1N1 and Ebola and things like that. So we're like, okay, well, it didn't show up here, so we're good, so we don't need to continue the investment. And what we found out is when you let that investment fade, eventually there will be this low probability, high consequence event that actually surprises you. And so I would say whatever R&D we do, and I think we need to basically take a lot of the current disparate efforts that are out there and link them together in a coordinated strategy to have early warning from biomonitoring, from wastewater monitoring. One of the things that we knew about in the bioterrorism program back in 2003 was we knew about we knew about SARS 5.5 months before it was actually surfacing as severe acute respiratory syndrome because of two things. One, the price of garlic went up tenfold in certain parts of Asia. So if you're monitoring economic price indicators, that can be an early warning of someone's rushing to market looking for a cure-all, in this case, garlic, because of something's going on here. The other way that we also knew about it was observations from space. Now, at the time, they were not commercial space assets that could actually tell you, but now we have commercial satellite imagery that in 15 minutes, or I'm seeing cases of commercial companies proposing 15 minutes or less at 25 centimeter resolution, if you see patterns of life changing and saying they're not going to the factories anymore, and there seem to be a lot of cars in the parking lot, that happened in 2003, and sure enough, that also happened with COVID-19. So if we bring this together almost as a public health network that can be early tipping and queuing, that can be something that we're always doing. So it solves the talent problem, it solves the sustainability problem, and it gets us ready, because guess what? COVID-19 in some respects was a dress rehearsal for the shocks that are going to come with climate change. And if we don't put that in place now, I guarantee whether it's 2023, 2025 or onwards, we're going to have more disruptions.
Great. Thank you, David. Chris, I'd like to bring you in here. Given your role on the National Security Commission on AI, I'm sure you have a lot of thoughts, and I know Jacqueline raised some thoughts related to Congress and R&D, but can you offer your thoughts here? Can you discuss how AI might create transformative effects in the health and biotech space? How do we need to be thinking about that, focusing on AI in terms of R&D and responses to health security and resilience in the face of other diseases?
Sure. Well, first of all, I'll just say thank you very much for having me. Really appreciate the chance to talk through this important topic. And I think there's been a lot of great points made already, so I'll largely build on top of those. So just first and foremost, I'll say really appreciate Frank's report highlighting the important role of AI going forward in either public health responses or really kind of biotech across the board. I think when we as the commission look at what are the key technologies that AI is really going to enable and transform in the future, biotechnology is almost always either near or at the top of the list. The fundamental reason, obviously, is that biology has principally become programmable. It's become a matter of code, and AI is a way to optimize code. And particularly when integrated with things like CRISPR editing, you're going to have the ability to read, write, and edit this biological code in a much more efficient way that's going to enable all sorts of new outcomes. So that's kind of where we come at these issues in general from. I think in terms of pandemic response in particular, it's also important to look at AI as a decision-making tool. And that's something that we see across the government a lot of need for. Obviously, with respect to pandemics, you'll have, if you have that kind of robust data set that's able to feed these algorithms, these tools, you'll be able to have much more proactive responses. I think that the examples that David highlighted in terms of early warning data on disparate data sets like economic price indicators on something completely unrelated, or satellite imagery, like these are the type of things that AI especially can look through and see correlations where humans could not. And do it much more easily. So I think as we're thinking about biotech going forward as across the board, we really need to see it as linked with AI. And we're thinking about R&D. We need to not only think about funding for traditional biomedical methods, but also our funding for basic research in artificial intelligence and in this type of development. I think the commission, by the way, has recommended that we double R&D spending annually for AI until it reaches $32 billion a year by 2026, which is about the levels of biomedical R&D. So we see a lot of links here. I'll also just say one other thing. I think that going forward, we also really need to think about biodata as a strategic asset. And I think that we don't do that nearly enough right now. And there's a lot of ways this could manifest. It could manifest in terms of better integrating data and actually producing the infrastructure to enable this type of analysis. But it's also, and that can be on terms of pandemic related things, or also kind of on things like genomics, right? And these much more big picture data sets that are going to enable these transformative health impacts. The government really needs to serve that integrated function because it plays a unique role there. And that is going to be key to the US biotech industry across the board going forward.
Real quick, if I could just jump on it, because I just want to amplify what Chris just said here about biodata as being a critical national asset and actually a global thing to think about as well. One of the things that I think the United States has the opportunity to lead on is showing a model that involves individuals in making choices. That if anything, what COVID-19 has also been, it's been a long time coming, is a top-down approach will not succeed at responding to turbulence such as this. And so one of the things that we've been advocating for, it's actually an idea that comes from England. They call it data trust, but they're really data co-ops. But it's this idea of, can you involve people in a participatory way to choose when and where they share their data and with whom? And then also have the equivalent of citizen jury or ombuds functions that can actually provide some auditing and oversight. And actually imagine if we had the 50 different states, each having citizen juries about what's being done with their biodata when it relates to testing or COVID-19. But the last thing I would also say real quick, the thing about biodata is also being critical is back in 2009, I wrote a memo at the time saying, who's following around the president of the United States, making sure we sprinkle false DNA everywhere they go? Because we're now going to be in a future when someone shakes your hand, they're going to be able to figure out what you're immune to and what you're not immune to, or what you're more susceptible to. And given that the COVID-19 vaccine, the great news story is these were things that were literally printed nucleotide by nucleotide to produce the vaccine. That's great. But that same technology, I always tell people, the good news is technology is getting democratized. The bad news is technology is getting democratized. If someone can shake your hand and then actually develop something that only makes you sick, how do we respond to that?
Yeah, I want to come back to that actually, because I think there's a really critical issue that you just raised there, David, in terms of biotech and bio warfare. Just on that point, because Frank raises in his report related to data collection, what is that balance? How can the US government balance effective data collection and usage for biosecurity with desired privacy requirements that the public will be asking about? An open question to whomever has thoughts.
A quick response, if I may. It's a very difficult balance to maintain. For one thing, we've already seen how a misunderstanding of HIPAA in terms of sharing public health data, which is a critical need in everything that David, Chris, and Jacqueline have talked about. How do we transmit data? How do we secure the data? To David's specific last point, we have some experience with democratic deliberation over biobanks. From neonates, you take a sample, and in Michigan, the state of Michigan has long maintained a biobank with all of these samples, tissue samples. Well, do people know what they're agreeing to? Do they care? Would they be upset if these data from the tissues, genetic data, are used longitudinally to either follow them, do they want to, or to have the government take it and use it? So you've got these problems on the ground that I think haven't been resolved yet. So I think it's definitely the right question. I'm not sure balance is the right rubric at this point. Here's where some really additional thinking would be needed, in my view.
And just real quick, just to build on what Peter just said, I agree. It's actually not balanced. It's actually go to the next level. We've got to show the next level of representative forms of government, empowering their people to have first the necessary biological literacy. If you don't have the necessary biological literacy, you can't make an informed choice here. But then necessary to have the connectivity and then the necessary access and opportunities to that data. I mean, it's great that we say we want people to go online and make these choices, but not everyone's connected in the United States. So we have to address that too. And so I think this is really about thinking about how do we take it to the next level and say this is a mandate for not just the United States, but any open society that wants to let people have choice. Part of that freedom of choice is being able to be informed about your biological self and what's being done with your biological self and how it links to the collective. The last thing I would just say is this also points to the larger problem. I know someone was asking this in the Q&A. It's about resiliency plus. It's about showing how we can effectively govern at speeds heretofore never been done before in a participatory way. And I think if anything, COVID-19 showed that the old way of governing is not going to work for the new way forward.
Thanks.
If I could just jump in for a minute, one of the things I think about with respect to data is there are techniques that allow you to keep an individual's information, I'll use the word anonymous for a minute, or protected maybe is better, but still allow you to use the full data set. Those techniques, I think, have to be well understood, worked on some more, but we need the data in the overall for some of these solutions, and we probably can protect the individual if we set it up correctly. Now, I'll leave that to the technical people. Maybe Chris wants to speak to that. But there are other areas, aside from biology, so to speak, where one is able to work the full data set, but not have to go to the individual piece of data.
Yeah, I'll just jump in and say I think there's things like homomorphic encryption that the Commission has looked into extensively, and I think are very promising areas that are most applicable in terms of the biospace, just given the obvious privacy concerns, but really are going to be very important across the board as data becomes more and more key to the operation of basically everything, and you'll be able to identify individuals from that. So yeah, I think that pursuing these kind of technical means is one element of that. I think the other element is sort of what David alluded to in terms of setting kind of norms and standards and expectations in terms of how we're going to deal with data. I think that that's a potential way that the United States can differentiate itself from some other countries, and especially its competitors that I think don't take this approach. And I think that can also provide some competitive advantages. But the U.S. government really has to be clear that this is really key, and also where other countries are less good about this and violating it, because it's putting everybody, U.S. citizens, allies, even their own people at risk.
Just a quick caveat, if I may. Until we solve the distrust of government problem, all of this is going to be problematic. And a quick anecdote, despite the ravages of the Flint water crisis, it's been difficult to get people to sign up for the Flint registry so that the children and adults can be followed longitudinally, because they lack trust in the government. And I suspect that when we talk about these newer technologies that are likely to be frightening, as David rightly said, where people don't have the nomenclature, the understanding, literacy, it's going to compound itself.
Yeah, and that's a really interesting point, Peter. And I'd like to turn that around to whomever has thoughts, because I think David mentioned, public involvement in decisions about their data more. That obviously involves better literacy. Peter, obviously, you in talking about the COVID-19 response, rightly addressed kind of public education, understanding of science as being obviously critical to mitigating future health security challenges. So just to that point of public literacy, education, of health issues, that will be critical moving forward. What are your thoughts from any of our panelists on how we address that?
Could I have a thought. I agree with Peter's concerns, but one of the things I think helps very much with the public is if we actually see successes. So the fact that there has been success with respect to the vaccine won't solve things for everybody, but it's going to, I think, cause substantial shifts in a good portion of public attitudes. Same thing to the extent that we can build an effective plan that has public health working more effectively, then I think there will be a greater degree of trust. I mean, Flint, by way of example, was just the opposite. So, when you live in Flint, why would you trust the government, right? But if you live in a circumstance where the government's actually been effective, that allows you to, I think, have a greater degree of confidence. Just to use an example, somebody mentioned in the course of this, I think it was Jane, nobody wants to go to the DMV. But a lot of DMVs now are online and pretty efficient, and it works a lot better. And people feel, okay, I don't want to go to the DMV, but at least I can have a decent result. We need to start to get some good results as a way of building public trust.
I certainly agree. And transparency, saying what you know, what you don't know, what the level of uncertainty is. And then I think you build on the successes.
I would also say that in some respects, you're going against US history. We threw a revolution against the king. We don't trust authority figures. That's in our DNA. We're all told the story of the revolution. And so we may need to look for governance necessarily distinct from government. And that may be at the local level. I mean, you look at, even though we do have an ethos of not trusting any authority figure, that's part of the US culture, we do still accept a decision made from 12 individuals on a jury. And we seem to be okay with that. And so if our culture is more we the people, how can we use that, even if it's not necessarily, it's government as a partner, but it's also people at the local level. It might involve reaching out to, if certain communities, faith leaders play a role. In other ways, it's other community leaders, that it's going to have to be ways of doing governance that may include government, but it's not up down from government. And so I think that's going to be so key, because you have to recognize our history is, unlike Canada, we did not have a peaceful separation from our king-like individual.
I would just add to David's point quickly, when we talk about genomic data and privacy, the precision medicine efforts we've been going after on the national level may yield some helpful hints here. The NIH All of Us research program, which launched a couple of years ago, launched with the idea to develop a 1 million person cohort, which will advance precision medicine in the US. And the idea is that in addition to biological indicators, all participants have their genome sequenced. It's stored in a biobank, which is housed by the Mayo Clinic. There are also some private partnerships, I believe, with Google and Alphabet. So it's your true sort of public-private partnership where there have been a number of possible lessons learned that we can glean as far as multiple language translations for communication to communities, awards to work on uptake, et cetera. And I think it would be remiss of us to reinvent the wheel without turning towards our first approach to this and seeing what's working, what's not, and how can we apply this even bigger if we're starting with 1 million, but that's still a drop in the bucket, so to speak, population-wide.
Thanks, Jacqueline. You raised something that I wanted to address in terms of public-private partnerships, actually, and what role public-private partnerships play in pandemic response. Perhaps specifically to dealing with protecting key critical infrastructure. Frank, in the report you mentioned, obviously the criticality of US supply chains and some vulnerabilities there, as well as vulnerabilities in cybersecurity that's significant for the healthcare sector. So be interested to hear your thoughts on that, both on the public-private partnership side, but also in terms of bolstering what do we need to do to bolster the resilience of our cybersecurity architecture? You're on mute, Frank.
I would think after all these Zoom conferences, I would know how to unmute. With respect to public-private partnerships, I think one of the things that is a tremendous success in the context of vaccine development is the incredible number of projects that went on, several of which, or multiple of which, have now come to fruition. But there were organizations counting, and the count varied between 100 and 200 different projects. That's a lot, and almost all of those were, in some sense, private sector. So I think what that shows is, with the right incentive, and in this case, I think the incentive wasn't so much money, but to actually try to do the right thing and the important thing for the country and the world, we really can bring the private sector and the innovation capacities, both in the United States and with allies and partners, to work on these issues much more effectively. I think one way to help do that is to have, I'll say NIH, maybe it's the National Institute for, I think it's Allergy and Infectious Diseases, have significant programming that they want to bring forward, and to go to the Congress and say, we really need to substantially enhance this kind of programming. We need to have maybe not exactly akin to what the Pentagon does, but a 5-year plan and a 10-year plan. We need to have some things that are going to be hard to achieve, and maybe they'll only win on 1 out of 10, but when we get the one, that'll be a big deal. And don't beat us up because not everything succeeded. Even a venture capitalist doesn't succeed on every part of venture capital. So I think it's a somewhat different approach to encouraging entrepreneurship, encouraging innovation, making sure that the support is there through the Congress and through funding, I think can make a difference. And then over on the cybersecurity side, the US and our allies and our partners really are very, very innovative. But one of the things that does concern me, and as you know, maybe some of the others know, again, I've written quite a lot on cybersecurity also. I mentioned in the report that we've seen a tremendous amount of attacks on both hospitals and on researchers. We need to make sure, if someone is a relatively small entity, they don't have time to have a very effective cybersecurity set of capabilities to protect what they're doing. So we need to create, in my opinion, I call it cybersecurity resilient architecture, but basically a system that small and medium-sized businesses could plug into, provide the cybersecurity for their information that needs to be proprietary information that needs to be guarded, and have that set of capabilities actually run by experts who know how to run cybersecurity. The analogy I would use would be financial. Most of us don't keep our money under the bed, under the mattress anymore. We use banks. And the banks run all that for us, and all we have is kind of these days, an electronic link and a bunch of electrons. But the system works actually very well. We need to have a similar system for cybersecurity. It's too hard to ask a small or medium-sized business, or for that matter, an individual, to protect themselves against highly capable entities like China, like Russia, which have publicly been identified as attacking with respect to the COVID vaccines, or against some of the significant criminal enterprises. So those are the 2 different sets of things I would do: a much more structured and supported research program, and a much more structured and somewhat changed cybersecurity program.
And if I could build on what Frank said and what he said both here and in his report, the analogy of most of us now don't keep money for ourselves. We put them in banks because we trust that the banks are going to do the right thing. Most of us also don't walk into buildings and start wondering if that building is fire code compliant. We assume that there's been something done where it's a combination of the private sector has built the building, government has made sure it meets the specs. We assume that it's got smoke detectors, and we assume that they're working and everything like that. We need the equivalent of how, if you were to go back 100 years from now and say, burning buildings, bad things, they kill people, they destroy property, but you can actually have these solutions that not only just let you know that there's a fire going on in the building and what floor is happening on, but they call the fire department and at the same time turn on a sprinkler system. We need to do the same thing both for cyber, because that's a case of, it's like fires, except it can happen very, very fast or very, very slow, and it's hard for humans to be paying attention to all the angles, given that technology is changing quickly. At the same time, we also need the same thing for biology. I really think about it that we should look back Success 5 years from now is when we look back and say, we used to think there was a separation between responding and always be monitoring for a possible unknown pathogen of either human or natural origin. And what we did is we got rid of that bifurcation, and we're just continuously monitoring for either adverse cyber events and responding to them much like how we would to fires. It's just we have the equivalent of digital smoke detectors, or biological events, and we're looking for that as well to automatically call the quote unquote fire department that should be responding, alert people of the concerns, and if possible, activate a sprinkler system as a remediation effort. So it is a case of the private sector providing these services that help with the monitoring, the identifying of interesting therapies, using machine learning and other ways to do it, and then obviously rolling it out.
Thanks, David and Frank. I wanted to raise one other question. Frank, in the report, raised the idea of creating an organized national approach for future pandemics. As he noted, that there's currently no national plan for pandemic response, and we've obviously talked about the lack of funding for public health. Opening this up to whomever wishes to answer, but maybe Peter or Jacqueline, what would be your primary recommendations for establishing such a national plan? Can we replicate successes from other areas to create this? And I know this panel, we have, experience spanning various US agencies from DHS, DOD, the CDC. Which agencies would need to be involved in building a national plan, and does that involve creating a top-down system for future pandemic management, and what are the benefits of that, and maybe some of the potential issues it might raise? Peter?
Yeah, I think it was David earlier mentioned his opposition to a top-down strategy. While I largely agree, I think what we're really talking about is cooperative federalism, the term used to talk about how the federal government can collaborate with state and local governments. To be blunt, it rarely works in practice. There's some good examples from the environmental area, whether they could be extrapolated to deal with climate change remains to be seen. But even there with Superfund, for example, where you have both federal and state responsibilities, there have been lots of delays and lack of cooperation. But it seems to me that this can't be a bottom-up effort, that there has to be a fair amount of federal governmental involvement for all of the reasons that we've been talking about. Take cybersecurity, for example. You can't expect state and local health departments, for example, to be developers and possibly even pay for the technology that's needed, which gets back to an earlier issue I hope we'll come back to. So I would just say, look, what's the federal government's comparative advantage? What are its core competencies in research and development, the procurement, the guidance? One thing that I think the government did well in the bioterrorism planning was building and paying for tabletop exercises so that you had all of the agencies at the state and local level and where needed federal level in the same room, at least identifying the challenges. So I think the onus is going to be on the federal government to provide the funding, use the full range of government to implement, provide mobile hospitals where needed. We saw some of that in COVID-19, mobile distribution centers, recipe books, guide best planning practices developed in collaboration with state and local governments. And let the state and local handle the distribution with funding, adequate funding from the federal government. I would add one quick point, and that is we will need a rigorous after-action report when the pandemic ebbs, so that we can really dissect what went right, what went wrong, how can we really learn for. I think the panelists have elucidated some great ideas, but we'll need to do more of that.
And if I could amplify on what Peter was saying, because I wholeheartedly agree, it needs to be a collaborative approach, recognizing we do have local and state and all public health is local. But thinking about how, I often tell people it needs to be an ecosystem approach. You don't tell ants where to go. You put sugar in certain places, you put chemicals in other places, and sure enough, the ants figure out how to get to the sugar. And so in this case, there's really three things that we can use to motivate it. First, we need to think about what can government do as a public-private partnership with private organizations and with state and local governments on infrastructure? Because we don't have the necessary infrastructure to even bring together this data. I mean, it's sad. I remember back when I was responding to 9/11 and then the anthrax events and later SARS, a lot of public health labs, they had fax machines, and they had to go to the library across the street to do fax machines, and that was challenging. We're apparently back there in some cases. So we have gone a full 2 decades and we're back there, and that needs to be improved. The second is the literacy, and that's less of a literacy on the actual public health part, but the general population needs to at least be aware of these issues to the degree that they can at least understand that I want to make sure that I can walk around and not be worried about an outbreak or a pathogen adversely impacting my community. And then finally, it's about convening for opportunities with the private sector, local and state. And again, it really is recognizing that this is really a iceberg moment of a larger trend, which is I tell people, the great news is technology is getting democratized. The challenging news is technology is getting democratized. And we've got to figure out new ways of working in this environment, whether it is cyber, whether it is bio, or whether it's the future interconnected shocks that will occur with.
I think we might have had, David has frozen, so we'll wait for him to come back. Unfortunately, cut him partway through. So Chris, I see you unmuting. Is there anything that you wanted to add?
Yeah, I just wanted to go in on top of what David's saying, which I think is exactly right. And zooming out a little into the framework that Frank provided in his paper, where he's talking about the strategic framework for critical infrastructure resilience. I think that's exactly right. And it really, the three things that David highlighted there was specific to the pandemic response, which are what we can do in public-private partnerships on infrastructure, the need for data literacy and awareness among the public, and then how do we kind of convene collectively for more opportunities. All three of those things are challenges across the emerging technology threat spectrum. And the government needs not only a specific strategy with respect to pandemic preparedness, which I completely agree with, but also a reconstituted vision of what constitutes a critical supply chain, and a more comprehensive assessment of kind of technology competitiveness going forward and the steps that are necessary for that. So from the commission standpoint, we are looking at some of these individual sub-issues, and obviously pandemics are at the top of everyone's mind. But the core problem is the United States needs to take steps to comprehensively assess its technological competitiveness moving forward and what it needs to do in the name of national security, broadening that definition for all of these emerging technologies, because that is exactly what our competitors are doing. And until we do that, we are going to remain behind.
That you raised an interesting question there, Chris, that I wanted to get at in terms of national security, actually. And Jacqueline, I'm keen to hear your thoughts here. Obviously, in terms of advances in synthetic biology, they've come quickly now that the technology is out there. And potential adversaries have obviously witnessed the profound potential for diseases such as COVID-19 to disrupt entire nations, institutions, our armed forces, which support them. So does this incentivize malign actors to develop targeted biological weapons? How can the United States and allies and partners get ahead of the curve to prevent future adversaries potentially using biosecurity scenarios?
Yeah, it's been sort of a perennial question for going on 20 years, and we do seem closer and closer in today's world. It's thankfully still a little easier said than done in many respects, but with the advent of CRISPR, as somebody has mentioned, and other technologies, we really are on the doorstep of sort of a whole new landscape of synthetic biology. Oftentimes, a lot of the precursors for something like that, if you're talking about bad actors, et cetera, reside within sort of public health or government-sponsored laboratories. So there's a little bit of overlap there. And I think, too, if you're to picture sort of a Venn diagram of synthetic biology and biosecurity threats, and then another circle of emerging infectious disease and outbreak/pandemic threats, there may be a lot of overlap there. And so the US has done a lot of work over the last decade to really try and thread that needle between how do we continue researching these, and then how do we keep that information secure while staying ahead of the curve in terms of knowledge. So back in 2012, I know DHS and DoD and other agencies were part of mounting dual use research of concern regulation, which applied to pandemics with pathogen potential. That framework has since been expanded. HHS now has something they call the P3CO framework that is supposed to guide their funding decisions on research that may create or transfer or use enhanced pathogens with pandemic potential. To your question, this time in our country may bring up, this may be the impetus to really reevaluate some of this and to really make sure that the directions we're moving in are the best ones. I certainly agree with Peter's mention about tabletop exercises. We've been doing that for a very long time. They always seem to be a good way to get disparate groups in the room. And I think also one more specific thing would be ramping up investment in global health surveillance, and particularly genetic surveillance. It was largely genetic surveillance that indicated that COVID-19 was not a synthesized strain, for example. And while most states in the US do have the technical capacity to decode viral genomes, we really lack the kind of unified national surveillance program that would standardize sequencing and reporting, not only, of course, of coronavirus variants, but anything being targeted. And sort of beyond the current moment, scientists can also use a system like this to help identify emerging pathogens, the other side of that Venn diagram, as soon as possible.
Thanks, Jacqueline. And I know we've just had David back with us.
Sorry, I'm going to assume someone did not like my comments on cyber resiliency and decided to take out my internet connection. So no worries. I am now joining by way of my phone's connection, which hopefully at least provides some sense of resiliency to the unknown. So.
Good to have you back. David, I wanted to throw you, we were just talking a little bit about biosecurity and biowarfare, and we just heard from Jacqueline. And Jacqueline just raised actually global health surveillance systems. I know this is something that you've been thinking and working on. So I wanted to get your thoughts on that in terms of what you discussed with regards to early warning systems, and that obviously being critical for our preparedness.
Yes, so I think we're going into a world in which, because of the democratization of technology, things that used to be done solely by government now need public-private partnerships that involve people. And back in 2000, 2001, I could have used the word syndromic surveillance or talk about, pandemic surveillance, and people were less concerned with that term. Nowadays, in 2020 and 2021, if I use the word surveillance, even if it's not involving anything about you personally, it immediately gets some people suspicious. And so we've got to figure out ways of informing the public as to what this is as early warning. We've got to make sure we show a new way that is consistent with US values that involve making sure it isn't about you personally. It's about large scale buying habits. Are we seeing the price of garlic go up or down? One of the things that we used to always do for VIP events when I was with the Biodata event is about 5 days before a VIP event where like the president was speaking, we would actually plug into over-the-counter drug sales, 911 calls, school absenteeism, not because we wanted to know the individual calls that were coming in, but if all of a sudden you see over-the-counter drug sales go up, that might be a sign of something possibly going on at that VIP event. And we did actually see at one of these major sporting events, we saw after the event a huge sale of gastrointestinal medications. There was not a Biodata event. It's the food that people ate at the sporting event caused them to want to then go to over-the-counter drug sales. But again, it's looking for these non-obvious signs that could tell us something's going on. And the fact that now in 2021, we can have commercial space companies that could inform, again, I don't want to know that it's David specifically walking out of his house. I want to know what are the general trends of activities of people going to work and not. And if I see all of a sudden there's a shift in that behavior, that could be a biological early warning, but it could also be an early warning of something else that we care about as a planet. So I think it's upgrading democracies and representative forms of government to deal with what we call the geotech decade ahead, where data and tech will have disproportionate impacts on how people live. And if we don't think about how we integrate everybody on this boat, if we do it just in a small set of conversations, I think people will be suspicious in open societies.
Okay, well, I wanted to turn now to some audience questions because we've had some interesting questions from folks. So I'll kind of pose these and open floor to whomever wants to respond. The first is from Sarah Brassen, who's with the Global Public Policy Institute in Germany. She says, resilience is key to the European Union's global strategy, but the EU increasingly understands resilience not merely as the ability to bounce back, but to adapt dynamically to new conditions. Do you think challenges like COVID-19 call for adaptive resilience? And if so, how could US institutions evolve for adaptive resilience?
So I would, real quick, I just do a quick one. I mean, that you're singing off my hymn sheet. That's what I saw with what happened in 9/11. That's what I saw what happened in SARS. That's what I saw what happened with West Nile virus. And these were things that were, almost now 20 years ago, 15, 20 years ago. And this is why, I'm not against some top-down approaches, but it's that what I've seen and what my research, and I did a PhD on this actually, demonstrating top-down approaches are insufficient when the environment is turbulent. And the condition I had back in 2007, which I think has shown out, is the world is becoming more and more turbulent. And so we've got to figure out this new way that still keeps some essence of a top-down approach with bottoms-up and does something more peer-to-peer. And that's why I use the ecosystem model, is that ants don't tell, you don't specifically tell ants where to go. They figure out where to go. Otherwise, you're absolutely right. If we don't figure out how to govern and adapt at a speed that heretofore we've not shown, autocracies will outperform more open societies like us. And so I would hope that this would be something that we could do collaboratively with our partners in Europe, with our partners in Canada, as almost a shared mandate to figure this out. How can we be adaptive and resilient for the decade ahead? Because we know shocks are coming. And we also know that the current way that we organize is insufficient for those shocks.
I agree. I would just add that without the investment in a lot of areas at the state and local level, you're not going to have that infrastructure to be able to adapt because for a number of reasons, but that's a biggie.
Yeah, that resources point, I think, is critical. Unless there are other thoughts on this, I'll turn to the next question, which is from Maria Koroleva, who is a master's student at St. Petersburg State University in Russia. She asks, as the threat of bioterrorism grows more prevalent, will we see increased activity by the United States within the framework of the Biological Weapons Convention? Furthermore, will bioterror developments reveal potential for verification mechanisms and frameworks of the Biological Weapons Convention? Jacqueline or David or Chris, I see you unmuting.
Happy to defer to others. I'm detailed to the commission from the Arms Control Bureau of the State Department, so I have a little background here. But Jacqueline,
I was going to say, you're living it on a daily basis.
I'll just say at the top, I think the U.S. concerns about the verification protocols under the BWC have more to do with the fact that it would not be effectively verifiable, and it would instill a false sense of confidence in states if we were to pass any kind of regime. Because simply put, given how proliferated this is, there's no way that you could actually have confidence in a state's compliance. So I think the concerns about the proposals for a verification regime under the BWC remain. I think that it certainly highlights the importance of multilateral collaboration on biological weapons and other pathogens in general. So I would think that there will be increased international focus on this, and particularly increased focus on the U.S. side. But I would not guess it would change the specific position with respect to BWC verification protocols.
And then to build on what Chris just said there, this is where in some cases Frank's report is so spot on in recognizing what we do for cyber in some respects needs to inform bio as well, because these are both areas where attribution for sophisticated actors is really difficult to do. I mean, you can triangulate as best you can get a high degree, but both of these are going to be areas in which, again, and then like all things, capabilities that used to be very exquisite and only in the hands of a few will then get to more mainstream and get democratized as well. So we need to prepare for a future, again, where Great news, personalized medicine will be here. And challenging news is personalized medicine, which can also be personalized poison, will be here too.
Okay. So we have two other audience questions that I want to try and squeeze in, and then we're nearing the end of our time. So James Tudor White, who's a scholar at the University of Birmingham, I'm assuming in the UK, said, David's comments about the US and its nonchalant stance resonate with the UK's own response. Both nations did not sufficiently fund pandemic preparedness because previous outbreaks of SARS and MERS had been less serious. In the long term, 10 to 20 years down the line, which is exactly the timeframe we're thinking about, do you believe that governments will again reduce pandemic preparedness and disregard the lessons from COVID-19? And I might tack onto that, how do we prevent that from happening?
Yeah. I'll give a real quick rejoinder and open it to others. I would say, if we're not careful, yes, they will. I mean, if anything, representative forms of government are programmed to deal with the short term. They're not programmed to deal with the long term well. You can look at a counterexample, which is Singapore is great. They create literally a 50-year plan every 10 years, and they spend a whole lot of money on working towards it. I can't imagine even the United States working in, let alone a 50-year plan, a 10-year plan, and reaching bipartisan agreement at the current moment. That doesn't mean we shouldn't try, but that's where I say government by itself will be insufficient, because until we start seeing representative forms of government be more long-term in their thinking, and I'm not sure it's, forgive the pun, in their DNA, we may have to have other ways of encouraging long-term thinking, whether it's through the public itself playing a role, NGOs playing a role, maybe the private sector, but even then, private sector has a lot of incentives to think short-term. And so if we can at least reach consensus on a system that should be in place, regardless of whether there's a pandemic or not, that is a system of distributed sensors, non-obvious ways of paying attention, is creating data streams that then can inform machine learning and detect it, that's something we can build towards and have always running in the background, so that 20 years from now, we don't lose attention from it. And if anything, we just say, that's just part of how we do building codes. That's part of how we do things, and it's always there in the background.
Our history, as David, you were arguing before, certainly would not be positive for learning the lessons. A lot depends, I think, on what actions we take over the next 3 to 5 years to respond. Do we implement Frank's vision? Do we take it seriously, fund it, answer the difficult questions, and move forward? If we do, then I think we might get a different result, because a lot of people are scarred. I mean, this has been a searing event for all of us, and maybe different from some of these others that were more, as it turned out, transitory.
Could I jump in there? One of the things, I'm more of an optimist than perhaps some other people. I quite agree that we haven't been very good in this arena. And we've had, I think, in about the past 15 years, about 10 different statutes, but none of them brought us to the level we needed. But on the other hand, for example, in the environmental area, we started, roughly speaking, about 1970 thereabouts, and have done quite a lot of good with respect to clean air and clean water, and standards got better. We're obviously at the front end now with respect to climate. David mentioned, safety standards that went with respect to fires. And if you go into the classic national security area, what we did during the Cold War, was bipartisan, and it continued. So I think one of the roles of government, but not just government, leaders at all levels, is to say this is really a significant problem that we have. We need to get the country, broadly speaking, to come along with it. Need to get the country to understand, as we did 50 years ago, why environmental changes are important, why safety codes are important, and we succeeded in that. So this is perhaps just another way of saying what Peter has just said, that we need to take advantage of the crisis and put ourselves on a route that allows us to actually effectively mobilize what needs to be mobilized.
Okay, well, with 5 minutes to go, I want to kind of pose a final question to you all and allow you to kind of give any concluding thoughts. So I think, we've talked a lot about COVID-19, lessons learned. We've spent a considerable amount of time thinking about future health security challenges. I think for those of us in the general public who don't work in the health security sector, I'd be interested to hear what each of you think about, what are the major health security issues that the US and nations worldwide might face in the future that we need to be preparing for now? And what are your recommendations for us to help mitigate that perhaps go beyond what Frank touched on? What other areas of opportunities have we not discussed? So be interested to hear your thoughts on both of those questions. So maybe I'll turn to David first, given he's unmuted.
All right. So I would say we really do need to look at this, as Frank said. I mean, we can do the right thing with enough attention and focus, and it needs leadership at all levels. We can't, I think we'll not succeed if we say that's someone else's job to do. If we say it's the government's job or the private sector's job or something like that, it's going to require a whole of society's response. And that's really going to be our challenge, which is assembling the necessary momentum to make a whole of society response happen is challenging, but is doable. And to Peter's point, maybe this has been enough of a scarring moment that it is going to provide that catalyst that we don't forget 10 years from now or 15 years from now. However, I would say we need to have obviously the focus on public health, but recognize it is broader than that. This is dealing with the fact that we are now approaching 8 billion people on the planet. The number of network devices on the planet is anywhere between 35 to 45 billion network devices. That number will probably double in the next 5 years. The amount of data on the planet in another 2 years will be approaching 120 zettabytes. That's 100 billion terabytes of data. To put in perspective, some say that's 3 times all the conversations we've ever had as a species. So we are drowning in data. We're going to be surrounded by sensors. It'll be really tempting for some societies to say, all right, surveillance state, solved, done. We don't want that to happen. And so this is a broader issue beyond just responding to pandemics and being resilient and adaptive to climate change and other things like this. This is really the order of how do we make sure we do not become a surveillance state as we use these technologies for good.
Chris, do I come to you next?
Yeah, I completely agree with what David said there. I think I'll build on that a little. I think in terms of major health security issues, I think the competitiveness of the U.S. biotech sector is going to be a critical national security problem going forward. Not necessarily problem, but challenge. I think that right now the biotech sector has sort of provided the light at the end of the tunnel in terms of our COVID response. Obviously, the deficiencies aside, which I think we've talked to at length, but the fact that we've gotten to where we've gotten with Operation Warp Speed with the vaccines is why we are, hopefully in a better spot right now. And I think if we were in a situation where that was not the U.S. industry, but it was a competitor's industry, especially if it was, a Chinese or Russian industry that was leading on those, this would be a very, very different world right now. And I think that our competitors see, especially how data and artificial intelligence and computing power are being merged with biology to create these kind of systemic advantages. And I think they're seeking to overthrow our leadership in this realm. And it's going to be critical that we focus on this as a national imperative to make sure that we maintain our current status of leadership, because I think that the experience in COVID highlights how much worse it would have been if that wasn't the case right now.
Yes. Ether, and then Jacqueline. And final thoughts. Oh, Peter, you're on mute, I think.
I had to find it, and like Frank, how many of these do I have to do before I can figure out how to unmute? I just want to go in a slightly different direction because I have nothing to add with David and Chris said. How are we going to use the money that Frank's talking about allocating to state and local public health? And I just very quickly suggest a few things. Infrastructure funding, defined as a much greater investment in technology, because we've got to have security at the state and local level. Otherwise, some of what you're talking about is going to be very problematic in terms of protecting data. And that includes buildings, labs, enhanced surveillance, capacity testing, contact tracing, etc. Second, staffing, woeful staffing needs. Public health nurses, for example, we have way too few in the pandemic as exposed that mid-career training. We need to Chris's points about AI, we need enhanced analytic capabilities at the local level. Right now, health departments can't even tell us what works, how to measure the value of public health services. So that's got to be ramped up. We need to fund the community transformation grants under the ACA, fund the prevention and public health fund also under the ACA. And all of those things will strengthen state and local public health.
Jacqueline, any final thoughts?
Yeah, the COVID-19 pandemic as it unfolded was sort of a perfect storm of events, but generally global interconnectedness plus climate change is a good recipe for emerging infectious diseases. So focusing on when does an outbreak become a pandemic? How do we catch it? How do we contain it? Investment in those realms is really critical. And as we've talked about staffing and personnel, I think one thing that has not been mentioned yet is the severely declining biomedical research workforce. The pipeline is drying up on the front end, training is expensive, compensation is insufficient. There have been a number of assessments done on this, but really starting with strengthening the pipeline at the front end is the beginning of a long multilateral investment that we need to make in both medical countermeasures by way of BARDA, the Biomedical Advanced Research and Development Authority, as well as the biomedical research workforce overall.
Frank, last but not least, the author of this report, any final things that you'd like to share?
Well, first of all, I think, and I really appreciate the panelists. I took a lot of notes, and this is one of these things where, as somebody mentioned at the beginning, I've been in government. I didn't write the report to write a report. I wrote the report so that maybe you can have decision makers both in government and at all levels of government, but also in the private sector take action. So I think that's the key thing. One additional thought, which I didn't discuss earlier, at the end of the report, I recommended that there be created what I call a resilience commission, something akin to the 9/11 commission, with participants, obviously from the administration, from Congress, from state and local governments, from the private sector, and from academia, to try and sort out not so much what happened, but what do we need to do going forward, and to figure out some of the structural things that we can do that can make future horrible events less likely. So we don't always want to respond. We want to head things off in advance if we can. And we also could use the Resilience Commission, if it were created, perhaps in a leadership role to avoid that desire to, get back to normal. If they have major recommendations, then, maybe we can help put those in place, the equivalent of creating environmental standards or the equivalent of creating a DHS, significant structural changes. So again, I just want to thank all the participants. And as I said, I've learned a lot and I appreciate it.
Thank you so much to our fantastic panel. This has really been an informative conversation. I've learned a lot. We've gone all over the map. There's so much kind of raised here that I think deserves attention and extra resources, research and kind of thought. So thank you to everyone listening at home and to our panelists for joining. Stay engaged in our work at the Atlantic Council, our Forward Defence team, our Geotech Centre. We're putting a lot of work out on this, so subscribe to our mailing list, follow us on Twitter, and we look forward to remaining in conversation with you all. Thank you so much for joining.
Thank you.
Thank you very much.
I know.
Bye.
Thanks a lot.